In today's interview of the week, I sat down with Dr. Andrew C., a Community Health Partners physician, who tells us why HIV prevention is still important and what options are available today. All right, Dr. C., thank you so much for being with us today and having this conversation with us about HIV prevention. It's a really important conversation to have and just a topic to discuss. So thanks so much.
Absolutely. Thanks for coming.
Why is HIV prevention such an urgent public health issue still to this day?
So HIV is something that is a lifelong disease. It is something that if we don't treat will end to very serious illness and death. So we know that that is still continuing on. We know that every single year, I think the most recent data there was something close to 30,000 new diagnoses of HIV in the United States. So we know that it's still an active issue, and it's actually a big issue here in the Central Valley as well.
Let's sort of start with PrEP, right? So first, tell me, what is it exactly and what kind of role does it play in also HIV prevention?
So I think that when we kind of first think about, for a lot of people, I think that there's a lot of stigma when it comes to HIV. And I think that there's a lot of scary things about it because people have either heard stories or lost family members or things like that. So I think that when we talk about prevention, we're talking about not just people within the LGBTQ community. We're talking about people that are at risk for getting HIV. And I think that when we know that we can prevent that, so we know that we have pills and we have injections that we can take that almost 100% protect us from having HIV. So we know that we can have freedom in our sexual health to go have partners and not have to worry about that.
Tell me a little bit more about the differences in these preventative medications.
So there are actually more options now than we've ever had. So there's 2 different kinds of pills that we can do and 2 different kinds of injections that we can do to prevent HIV. The first one that came out was called Truvada, and that's still around today. That's approved for everyone that wants to take it to prevent HIV, and that's really effective. It's just 1 pill a day, and it can prevent about 99% of HIV infection. Same thing with Descovy, so that's another pill that they can take once a day. That's primarily for men who have sex with men or transgender women. Again, it's a pill once a day. It's about the size of a Tic Tac. It's pretty small, pretty easy to take, so that's another option. When we talk about the injectables, there's 2, so Apretude or cabotegravir. So that's a intramuscular injection, so kind of like if anyone's ever gotten like a penicillin shot or anything like that, it's very similar to that you get every 2 months in the clinic. That's, again, almost 100% effective at preventing HIV.
With these medications, prevention could potentially lead to completely eradicating the disease.
I think that would be amazing to be able to see that in our lifetime, that we could take something that is a death sentence for decades to now say that we don't even have to deal with that, and to deal with the consequences from that is pretty amazing.
Tell me a little bit more about how really there's options for even women. Women should be on this medication.
Absolutely. I think that that's one of the biggest areas that I think so certainly for the LGBTQ community, the Descovy is one that's primarily, it's for FDA approved for men who have sex with men and transgender women. The other 3, so Truvada, Apretude, and Yeztugo, are all approved for all people. Yeztugo actually did a study, and they're approved for even women that are pregnant. So I think that, to me, if you are a person who is, having a relationship with other people and you just want to be comfortable and know that you have a 99.9% chance of not getting HIV while you're on these medications, I think that's a great freedom and a great liberty that kind of opens you up.
Thank you so much, Dr.
Absolutely.
C.